Norovirus is spreading across the country as people prepare for New Year's Eve celebrations. Brooke Taylor explains the best ways to protect yourself.
3, 2, 1, Happy New Year!
In Times Square, New Year's Eve organizers test the confetti, where nearly 1 million people are expected to gather Tuesday to ring in the start of the new year. But with close proximity comes added risk. The CDC warning that the highly contagious norovirus, commonly spread where people are close together, is on the rise nationwide. Outbreaks recently reported on cruise ships out of New York, as others report noticing more people sick at schools or at work.
Where I live in my building, there's a few people that are sick, a few people at work that got sick last week too. It's going around.
Since early December, the CDC reports a doubling of norovirus cases compared to previous years, also known as the stomach flu. Doctors warn norovirus can cause significant nausea, vomiting, and diarrhea.
What happens is it causes inflammation of the stomach lining and the intestines, and that's where you get the nausea, you get the vomiting, and then you get the diarrhea. And it can really make you feel like you know what.
Most norovirus outbreaks occur when people already infected spread the virus to others, sharing food, drinks, or exposure to contaminated surfaces. Over the holidays, health officials warn it's important to be even more vigilant as families and friends gather in tight spaces.
Hand hygiene is very important and very beneficial, especially for kids. It can be very hard to maintain, but avoid touching your eyes, your nose, your mouth, and even your food if you are exposed to really any sick contacts, and washing your hands before you do so.
And symptoms typically develop between 12 to 48 hours, and people usually get better between 1 to 3 days. In Dallas, I'm Brooke Taylor, Fox News.